See important safety information and full prescribing information at the end of the video. Only your doctor can determine if this therapy is right for you.
I think for starters, it's helpful to understand what spasticity is. And so I like to think about the coordination of muscles. If I want to bring my hand to my face, two things have to happen. This muscle has to shorten, and that brings my arm forward. But also, this muscle has to relax. If this muscle doesn't relax, then I can't pull my arm forward. I don't choose for my tricep to relax when I want to bring something to my face. I just say food to face. The spinal cord and brain relax the tricep for me, and there's this symphony between these two muscles. When you have damage to the brain or spinal cord, sometimes that communication's lost. So when you choose to do this, you're also doing this. And the result is these two muscles start to fight and they don't bend. That's spasticity. And really that manifests in three different ways. You can have a limb that's hard to bend. And so it's hard to get in and out of a car because you can't get your leg to move, or it's hard to walk because your knee doesn't bend. You can have spasms, which are involuntary movements that you can't control. They can be very interruptive. They can sometimes throw you out of a chair. And lastly, you can have cramps, like a Charlie horse, which is very, very painful and can wake you from sleep. And so that essentially, clinically, is how spasticity presents. As you can imagine, spasticity is a spectrum of a disease. And so it can be very, very mild. And someone can just have a tight calf, and if they stretch it out in the morning, they do fine. On the other end of the spectrum, spasticity can be neurologically devastating, and you can be trapped inside your own body. It can be exceedingly painful and make it so that you can't wash your own hair, put on your own clothes, or walk. So spasticity needs to be addressed when it's bothersome. Having spasticity in and of itself doesn't necessitate treatment. It's when the spasticity limits what you can do. I've taken care of patients who are profoundly stiff, but it doesn't bother their day-to-day activities and they choose not to be treated.
ITB therapy with Leorosol intrathecal baclofen injection is a treatment that may relieve some of the symptoms of severe spasticity. People who have severe spasticity resulting from cerebral palsy, multiple sclerosis, stroke, brain injury, or spinal cord injury may be candidates for ITB therapy. When spasticity is due to spinal cord injury or multiple sclerosis, oral baclofen must not control spasticity adequately or have intolerable side effects. ITB therapy may be considered 1 year after a traumatic brain injury. Safety and effectiveness have not been established for children younger than 4 years old. When receiving ITB therapy, make sure you follow your clinician's instructions closely. A sudden stop in therapy can result in serious baclofen withdrawal symptoms, such as high fever, changed mental status, muscle stiffness, and in rare cases may result in the loss of function of many vital organs and death. It is critical that your clinician be called right away if you experience any of these symptoms. Make sure you keep your scheduled refill visits so you don't run out of medication, baclofen. You should also know the early symptoms of baclofen withdrawal. Some people are at more risk than others for baclofen withdrawal. Speak with your clinician about this. Seizures have been reported and can be associated with overdose, withdrawal, and maintenance therapy. A screening test will help show if you will respond to the intrathecal baclofen. You should not receive ITB therapy if you have an infection, are allergic to baclofen, or have a body too small for an implantable pump. Implanting the system has possible risks, including infection, spinal fluid leak, and headache. Pump or catheter problems can occur after implantation, which may require corrective surgery. Complications may cause a return of your spasticity symptoms or symptoms of overdose or withdrawal of intrathecal baclofen. An alarm should sound if there is a problem with the pump or if the pump needs to be replaced or filled with baclofen. Always inform healthcare personnel that you have an implanted infusion system before any medical or diagnostic procedure, such as MRI or diathermy. The most common drug-related side effects of ITB therapy include loose muscles, drowsiness, upset stomach, vomiting, headaches, and dizziness. Intrathecal baclofen may cause drowsiness. Use caution when driving, operating machinery, or performing other hazardous activities. Use of intrathecal baclofen with other depressants and alcohol may increase drowsiness. Titration is required to determine the best dose for treatment. You and all caregivers must receive adequate information regarding the importance of keeping scheduled refill visits and should be educated on the early symptoms of baclofen withdrawal and overdose. Not everyone responds to ITB therapy in the same way. To understand the benefits and risks of drug delivery therapy, please discuss them in detail with your physician. A prescription is required. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more, talk about ITB therapy and Liorasol intrathecal baclofen injection with your doctor and refer to the FDA-approved product labeling. Please refer to the full prescribing information about ITB therapy accompanying this video. You may also visit Medtronic's website at spasticity.com/safety.